Okay, D1. So I'm going to try and show you guys what we're looking for on your preps, what you can learn to look for on your own. This is Dr. Taylor's prep. We're going to kind of go through it and look. I'll make some models so you can kind of see these and compare yours to it. But as you ask for help, we hit kind of the same topics over and over and over. So starting looking at the interproximal reduction, the angle there. We want to be coming in at an angle that mirrors the adjacent proximal surface. So these two lines should be parallel. That looks pretty good there. And then here, let me get this lined up in the monitor. That we mirror this here. We're maybe slightly over tapered there, but pretty close. So that's pretty close there. Then we're looking at axial reduction. Let me get this so it's at the right focus point. That looks pretty good right there. So you can see that our axial reduction on this tooth is pretty uniform all across the tooth. We've got that, let's see how thick it is. Yeah, right about 1.2, 1.3 all across there, and it's pretty uniform looking straight down. You can see that we drilled into this tooth and reduced that all around about that same amount. Now let's try and look down the occlusal plane here. Let me see what's a good angle. We'll do a little of both. So one thing we're looking at is, did we keep this tooth in the correct orientation? Did the central groove stay lined up with where it was and with the adjacent central grooves? Did the buccal cusp tip stay in line and lingual cusp tip? We don't want to transpose those way off to one side or the other. We want to keep the tooth in the proper alignment. And then are we mirroring what's going on? Here's a good view for that. So on this buccal, it's hard for me to see and do this at the same time. This plane should mirror the adjacent plane, and that plane also exists in the molars here. So that should stay at that same angle, opposite for the lingual. Sorry, I'm a little slow and clunky on this. I'm trying to do it direct vision and indirect vision at the same time. So that mirrors that plane you're seeing on the premolar as well as on the molars. So for this tooth, we've got our functional cusp bevel here, then the functional cusp and non-functional cusp. And we want to keep those lines the same. If your angle comes in too flat compared to the adjacent teeth, you're going to end up with your central groove up too high and not enough clearance there. If you come in too steep, either you're going to be too tall up on your cusp tips or too deep down in the central groove. Let's look down the buccal where you can see the two planes of reduction. Let me get this so it's good on this monitor. That's pretty good right there. Okay. So as we look down here, you can see the different planes. There's this first plane in the gingival third, and then the second plane in the occlusal 2/3. And we're mirroring the adjacent teeth. So you can see that this first plane, 1/3 of it, you don't want to tuck in quite as aggressively as that shows, but we're going to be kind of more vertical, or maybe just tilted in a little of vertical, but then we're going to really be angled on that occlusal 2/3 there. So you can see that on this prep. There's the first plane and the second plane of reduction there. This is our non-functional cusp bevel. It's light, but it rounds that off and smooths it, compared to the functional cusp bevel has a lot more reduction here. All right, let's pause that. Quick look at occlusion here. This part's a little tricky over video, but what we're doing here is we have this fit checker, which is 1.5. So if we've got 1.5 of reduction, this should slide in there. And we're gonna start, let me get the correct angle for the screen. There we go. We're gonna start on the buccal here. So in this case, this is our non-functional cusp, and we're checking it at the same angle as this cusp there. So I'm coming in, mirroring that angle, and can this pass through? And it does pass through pretty well. So next we're gonna check our functional cusp. Sorry, let me get it in the screen right here. So we're gonna come through checking at that same angle like this. So we go from the buckle, we're going up, checking that non-functional cusp, then coming back uphill, checking that functional cusp. And if this passes through and I can feel it's a little tight, that means we've got the clearance. And then for that functional cusp bevel, we're going back downhill after that. That's a little hard to check in the mouth. I can cheat through here and come in and pass through there to check that functional cusp bevel on here. But the big mistake a lot of students make when they're new is they try and check this with this horizontal. We don't check it like that. We're mirroring the angles of these cusps. So we're checking like this, then back uphill like this, then back downhill like that. So I'll kind of go through that one more time. So I'm checking on the buckle here with this non. Let me get that occlusion better. Checking here on the buckle on this non-functional cusp. So passing through, then coming back up the functional cusp, and then ultimately coming through on the back end there. Another way to like kind of tell what's going on with your occlusion is it's easy to see on that buckle, and then you can kind of see your mirroring following the adjacents. Are you going down at the correct angle, and does the clearance look reasonable?